Older adults. Aging is not a disease, but a normal part of the human condition. It cannot be prevented, and the process of aging often requires many difficult transitions. For most people, it means retirement, a substantial drop in income, health problems, death of friends and relatives, and other social adjustment. The older adult population, also called seniors or elders, is generally defined as those 65 years of age and older. They currently make up about 13% of the American population. More than 70% of Americans will live to age 65, and more than 30% will live to age 85. The older adult population is expected to double by 2030. To gain some perspective, in 1989, 1 in 10 Americans were over 65. By 2030, we expect it to be 1 in 5 to be over 65. The baby boomers are driving the increase in the older population. And baby boomers are defined as those individuals who were born between 1946 and 1964. The Food and Nutrition Board divided the older years into 2 stages based on requirements for various nutrients: 51 to 70 years of age and 70 years of age and older. The older adult population can be divided into 3 age cohorts: 65 to 74, the young old; 75 to 84, the middle old; and 85 and older, the oldest old. Those age 85 and older are the fastest growing age segment of the American population. The human lifespan is the maximum age observed in humans, which is usually defined as 120 years. Life expectancy, on the other hand, is the average number of years one can expect to live given your sex, date of birth, and race and ethnicity. The life expectancy for someone born in the year 2000, for example, is 77 years. You can see on the graph, when we look at life expectancy, that white females have the highest life expectancy, followed by Black females slightly, white males, and Black males have a much lower life expectancy. Now let's take a look at the aging body. Age-related changes in body composition, sensory abilities, organ systems, and immune functions are normal. We all age at different rates, and many age-related changes will have little impact on our everyday lives. Other changes affect our nutrient needs and nutrient status, so it is especially important to eat a healthy diet. Although we cannot stop the aging process, we can develop healthy lifestyle choices that can contribute significantly to the quality of life in our older years. Lifestyle factors such as eating habits, physical activity level, smoking, and alcohol use not only increase our risk of chronic disease, but also the rate at which we age. Nutrition is a key factor in promoting health and ability to function at advanced ages, and it also plays a role in medical nutrition therapy for disease management. Body composition. Lean muscle mass, strength, and flexibility usually decline with age. These declines are not due simply to aging, but also to a decrease in physical activity. Loss of lean body mass and muscle strength can result in a condition called sarcopenia. And sarcopenia contributes to functional disability and loss of independence. The decrease in lean muscle mass and the increase in body fat also cause a decrease in basal metabolic rate, or BMR. Some of these declines can be offset by increasing physical activity. Immune system. Immune system function decreases as we age, and the body loses some of its ability to fight illnesses and infections. Inadequate consumption of protein and some antioxidant nutrients can compromise immunity and health in older adults. Sensory changes. Aging results in several sensory changes, including decrease in taste, smell, thirst, vision, nerve sensitivity, and manual dexterity. Oral health. Half of all individuals over age 50 have lost all their teeth. And many of these individuals also have no dentures or poorly fitting dentures, which results in difficulty chewing foods such as meats and raw fruits and vegetables. Gastrointestinal changes associated with aging include decrease in saliva production, secretion of gastric acid and digestive enzymes, and muscle tone. As a result, constipation, gas, and bloating are common complaints of old age. Osteoporosis. Bones are living tissue, which are constantly being absorbed and replaced. Osteoporosis occurs when the creation of new bone doesn't keep up with the removal of old bone. Osteoporosis causes bones to become weak and brittle and increases the risk of bone fractures, especially in the hip, wrist, and spine. Those at highest risk for osteoporosis are white and Asian women who are in menopause. Consuming adequate amounts of calcium is necessary to prevent osteoporosis. Men and women age 18 to 50 years of age need 1,000 milligrams of calcium daily. Women 51 years and over and men over age 70 need 1,200 milligrams daily. Individuals between 1 and 70 years of age need 600 international units a day of vitamin D, and those 70 and older need 800 international units per day. Regular physical activity, especially walking and strength training, can strengthen bones and prevent bone loss. Nutritional needs. Energy needs decrease with aging primarily because of reduced physical activity and decrease in lean muscle mass. Individual energy needs depend on physical activity level, lean body mass, and the presence of disease. And older adults who are bedridden or wheelchair bound require fewer calories than a mobile person. Protein needs remain the same even with decreased energy needs. The RDA for healthy older adults is 0.8 gram per kilogram of body weight, or on average 46 grams per day for women and 56 grams per day for men. Older adults should aim to include 25 to 30 grams of high-quality protein with each meal. The diet should consist of about 45 to 65% carbohydrates. And carbohydrates should come primarily from whole grains, iron-fortified cereals, and fruits and vegetables. Sugar-sweetened beverages, sweets, and desserts should be kept to a minimum. We want to make sure that the older adults are eating foods that are nutrient dense. The fat intake of older adults is usually at or above the recommended amounts. So in general, no more than 30% of calories should come from fats. And older adults need to reduce their intake of total fat, saturated fats, and cholesterol to reduce their risk of obesity, heart disease, and certain cancers. Common vitamin and mineral deficiencies in the elderly include vitamin A, thiamine, riboflavin, vitamin B6, B12, folate, vitamin C, calcium, and zinc. Many elderly may not show signs of deficiencies until an illness, surgery, or accident. And most do not need a vitamin and mineral supplement if they are able to eat an adequate, well-balanced meal. A decreased thirst response and reduction in kidney function can increase the risk of dehydration in older adults. In addition, diuretic medications, alcohol, and caffeine increase fluid excretion and contribute to dehydration. Fluid recommendations for older adults are the same as for younger adults. Nutritional assessment. Assessment and screening of the older adult are needed to identify those at nutritional risk. More than 85% of the older population suffers from chronic diseases that could be improved by dietary intervention. Being underweight is associated with malnutrition and higher death rates in those over age 85. Being underweight may be due to increased energy needs, poor appetite, altered metabolism, alcoholism, and poor oral health. In addition, those with Alzheimer's disease and Parkinson's disease have higher energy needs. A nutritional assessment for the older adult should include medical history, social history, diet history, drug and medication history, weight, height, and BMI.